I'm Nova Scotia's Minister of Environment and Climate Change. I'm also the member of the Legislative Assembly for Dartmouth East. I just want to take a moment to convey to you how pleased I am to have my colleagues, the Minister of Health, Michelle Thompson, and of course the Premier of Nova Scotia here in Dartmouth for a significant announcement. Along with that, my good friend and colleague, the MLA for Cape Breton East, our Minister for the Office of Addictions and Mental Health, Brian Comer, is with us here today, along with staff from the Nova Scotia Government Employees Union, along with staff from the Nova Scotia Nurses Union, and staff from the government of Nova Scotia. So pleased that you are here at the Dartmouth General Hospital. This is a hospital that is very near and dear to my heart. We have many people here today that this hospital is very near and dear to their heart. I think of community member Al McPhee, for example, who has just been so instrumental, among with so many others, in giving support to this hospital. And since I was a little boy, my mom was a nurse. She was a certified nursing assistant, what you would call an LPN. Today here at this hospital. So to see the community attachment, to see the growth is significant. So just about a year ago, we hit a major milestone in the QE2 New Generation project when the expansion and renovations were completed here at the Dartmouth General. Look around. We can all see that it's been transformed into a state-of-the-art facility. More surgical capacity, more diagnostic imaging capacity, more outpatient and inpatient capacity. It is obviously a bright, modern facility, as you can tell, and I have no doubt it's a nicer place for patients and their families and for our healthcare professionals. But we're not here today to talk about facilities. Today, we are here to talk about people. And as the Premier always says, people is what it's all about. That is why we are here, and that is why we serve. There are so many people who make up the healthcare teams that look after us when we need it. So today is about them and recognizing all that they do for Nova Scotians. And with that, I would like to welcome my colleague, a phenomenal leader, our Health and Wellness Minister, Michelle Thompson, who will say a few words before Premier Houston makes today's announcement.
Good afternoon, everyone. Thank you, Minister Hallman, and thank all of you for coming all over. It's great to see so many folks here. I'm glad to be part of today's announcements and to see a few familiar faces. As Minister Hallman mentioned, we're here today to talk about people. We know that one of the main issues that we're facing in healthcare today is a shortage of healthcare workers, which is a shortage of people. The last few years have really exacerbated things. Our healthcare workers have told us they're stressed, they're tired, and at risk of burning out. And our healthcare team members have been doing more with less for years. They've told us they're worried about the impact of constantly working short. Some have left their professions, some have retired, some have dramatically scaled back their hours, and it's really unfortunate. Some have retired, but it's unfortunate because many of us got into this work because we wanted to care for people, and we need them to care, to come back. Our first month on the job, I joined the Premier and other members of the health leadership team to tour the province and meet with healthcare professionals and others working in the system. We listened as they told us about their experiences and their challenges, and we committed to improving things for them and for the patients they serve. A big part of that is making sure that we have the staff we need. We have worked hard to recruit and retain healthcare professionals of all stripes with a particular focus on nurses, paramedics, physicians, and continuing care assistants. We have added more nursing and paramedic seats. Our partners are working to simplify the licensing process for providers that want to come and work here. We've given continuing care assistants a significant raise. We've introduced tuition rebates for paramedics, among many other actions. As a nurse and a former administrator at a long-term care facility, I know that every person on a team is crucial to the care that we provide. I've worked in long-term care, critical care, public health, community care, and others over the years. And I've worked alongside the people who help us book our appointments and answer our questions when we call, prepare and bring meals when we're in hospital or long-term care, help us get back on our feet and back to our routines, run lab tests or x-rays or CT scanners, help us get from one area of the hospital to another. They look after us and bring comfort in our homes or in long-term care facilities, and so many others. It really does take a village, and I thank each and every member of the team for the work that you do and the ways you contribute. They are all important roles and rewarding professions. They come with joys, struggles, and a sense of pride in doing something that helps people, something that matters. I also know what it's like to work in challenging situations and in a healthcare system that needs change. It's why I'm so passionate about what we're doing and why the Premier has made it clear that we must do more and we must do it faster, always faster. We are listening. We know you need our support. We're working hard to build a system that you deserve, and we won't stop until the work is done. And it's my pleasure now to turn it over to Premier Houston to make today's announcement.
Well, thank you, Minister, and thank you to each and every one of you for being here today. I have to say, I'm filled with a lot of emotions right now. My brother spent the last days of his life in this building 5 years ago, and he received exceptional care. A lot of memories coming back, but the faces I see out there today remind me of the care he received in this facility. I want to thank you. I want to thank you for that. I want to begin by saying what an honor it is to be in this position and have the opportunity to interact with healthcare workers such as yourself, and to meet you, to be joined by you at announcements like this. You are truly healthcare heroes for Nova Scotians. You invest so much, going above and beyond, looking after us, looking after Nova Scotians, taking care of us and taking care of our loved ones, literally saving lives every single day. Every single day at hospitals around this province, at care centers, at clinics across the entirety of the province. Every single day, nurses and healthcare professionals are asked to shoulder an enormous burden. Monitoring, treating, providing world-class care to patients who are also dealing with an enormous range of healthcare challenges and their own emotions. You are the face of the healthcare system, and you are the source of comfort and support to patients and to their families, certainly in their darkest moments many times. You know that they have dozens, we know that you have dozens of other patients that you're dealing with, but it never feels that way to us, never feels that way to the patients. And that's an incredible talent. And that's a skill that continues to amazes me. Our healthcare professionals, our nurses do such an amazing job day in and day out. And the workload continues to grow. The pressure continues to grow on you, overstaffed, understaffed, overworked. You face it with a do not quit attitude, and we see it. But unfortunately, we know that the pressures lead to many nurses and healthcare professionals burning themselves out. So we have to fix that, don't we? We feel that. I feel that pressure as Premier. We feel it as the government. So the challenge to me and to Minister Thompson and Minister Comer and Minister Adams and those of us that have a direct responsibility for our healthcare portfolios and the entire team, the challenge to us is how can we show you, how can we show nurses and healthcare professionals the same level of commitment that you show us? That's the challenge. How can we say thank you? How can we recognize your sacrifice and say that to you, as long as you keep working in Nova Scotia in our healthcare system, your government will have your back. We will do what we can to support you. So when I said I would invest whatever it takes to fix our healthcare system, I say that all the time. We will make the investments that are necessary to fix our healthcare system. I absolutely mean it. We're committed to doing that. So today, we're saying thank you to nurses employed by our publicly funded healthcare system by paying each of you a $10,000 retention bonus, no strings attached. $10,000 retention bonus, no strings attached. And to each nurse who commits to staying with us on this healthcare journey for another 2 years, we're going to provide an additional $10,000 bonus. So that means potentially $20,000 for nurses. For those that are here with us and who are staying with us, and if you're casual, if you're a travel nurse or a retired nurse who is willing to return to a position in our public healthcare system and commit to staying two years of full-time work, we'll also provide a $10,000 incentive to you as well. In a time of rising cost of living, I hope that this money will make a difference to a lot of families around the province. So my message to every nurse in the province is simple. We need you. When we invest in nurses, we are investing in better care for all Nova Scotians. So while the first part of today's announcement is about recognizing nurses and addressing the nursing shortage, when we made this decision, we've been well aware that there are many other healthcare professionals who contribute so much and who have sacrificed so much to help keep us healthy and safe. There are many who don't feel seen or recognized, but we see you. It takes a real team to deliver the kind of care patients receive at places like this, like the Dartmouth General. So whether it's our paramedics, our respiratory therapists, our clinical assistants, our physiotherapists, whether it is the hard-working people in housekeeping or in the kitchen staff or support services, through the pandemic and beyond, the last few years have been very, very long, and they've been hard. So we're also saying thank you to many other employees of our publicly funded healthcare system by paying each of them, each of you, a bonus of $5,000, no strings attached. So in total, we expect more than 55,000 people across the province will receive an incentive just in the next few weeks. To our healthcare workers, no matter what you do, we're grateful and we need you. Money certainly isn't everything, but it's something. It's a way to recognize your effort, to help keep people working in our healthcare system, to bring people back to our system, to support each other, to increase the odds that when you're in the middle of a hard shift and you're feeling overwhelmed and someone is standing beside you, so you know that someone is standing beside you, ready to pitch in and help. We're all in this together. We really are. This is how we fix healthcare, one solution at a time. We're not going to kick the can down the road and ignore the problem like has happened in the past. We're gonna pick it up and we're gonna deal with it. So whether it's investing in more doctors, new medical schools, whether it's making historic capital investments to open more emergency department capacity and build more beds, whether it's embracing technology and data, embracing virtual care, expanding the role of professionals like nurse practitioners and pharmacists, we are taking an all hands on deck approach to fixing healthcare today and over the long term. And that's why Nova Scotians elected us, to fix a broken system, to tackle the long-term problems, to work with you, those who have sacrificed so much, to give you the support you deserve. The work is not done. There's a lot of work to do, for sure. We know that. It's going to mean more and more solutions to support each of you at work every single day. But I will not rest until we get there. And we will get there. Thank you. Thank you. And we will get there. We will get there. I promise you that. But for now, I just want to say thank you to everyone working in our healthcare system. I certainly want to say thank you for everything you have done and continue to do to keep us healthy and safe. Thank you so much.
Wow, that's amazing. Absolutely amazing. Premier, Minister Thompson, thank you so much for being here in Dartmouth. To our nurses, every one of our healthcare professionals, from the bottom of our hearts, thank you so much for all that you do to support Nova Scotians. As the Premier said, please know on our end, we are doing everything we can to support you. That being said, the Premier and Minister Thompson will now be available to speak with media immediately following this event. So if you want to set up for a scrum, prepare to do so. And as always, our colleagues at Communications Nova Scotia will facilitate. Thank you, everyone.